Hey guys, this is Dr. Baird of Evolve Performance Healthcare. Today we're going to take you through a typical treatment for low back pain following a car accident. So we've already taken Brittany through the exam, and what we found was the joints of her lumbar spine became a little bit compressed. She probably was a little bit hyperextended when she got in that accident, which compresses those joints and causes irritation. And then as a result, the muscles surrounding that spine kind of go into spasm, and what they're doing is just trying to protect that area. So we're going to show you a couple techniques to help treat that. The first is going to be a chiropractic adjustment, which we're going to use again to treat those joints, restore motion, and again speed the healing process there, followed by some cupping and some instrument-assisted soft tissue massage to help decrease the tone of those muscles, decrease the pain in those muscles, and then follow it up with a K-taping application that'll help provide some support for when she leaves the office. So first thing we'll do is the adjustment. So we're going to have the patient roll onto their side. We're going to just bend the top knee up and drop that back shoulder. And then it's just, again, just nice and controlled, slow adjustment. Nice little impulse through the mid-back. You hear a nice little pop. And then from there, we're going to have the patient go face down. And we're going to start with the instrument-assisted soft tissue massage. So that's just a stainless steel tool. Looks scarier than it actually is. And we're going to just, again, use these lumbar erectors. Those are the ones that commonly go into spasm after a car accident. So we're just going to use a little bit of gel. And again, when we're decreasing the tone of the muscle, we really want to focus on slow and controlled strokes. What they found is, again, it's just you're stimulating different receptors. And when our goal is to decrease the tone of a muscle, so muscles that have gone into spasm, we want to use deeper, slower strokes. And it doesn't need to be a long time either. So what we'll do is we do this for about a minute on one side, and then again we want to make sure that we do it on a minute on the other side as well. Just slow and controlled to decrease the tone of those spinal erector muscles of the low back. So we do that for a minute, and then we want to follow it up with some cupping. So we do in the clinic because we use these silicone cups, and what they do is they lift up on the skin to bring blood flow to the area and to speed the healing process. So feel really good actually. We're just going to put them on the low back, lifting up on the skin, and again we're just going to let those sit for a minute. So again, what these do is bring blood flow to the area to help speed the healing process. The other thing that's nice is, again, it provides a suctioning effect, which helps lift that skin layer up off the muscular layer. That's where a lot of our superficial nerves lie, which again, when those get irritated, especially following a car accident, can contribute to pain. So when we can lift that skin layer off of that muscular layer, we help, again, take adhesions off of those superficial muscles. So this is just something we're gonna leave on for a minute to 2 minutes. Doesn't need to be too long. You can also move them around. Again, that's what's nice to gel, to cover more surface area. And again, then you can let them sit there as well. Once those have sat for 1 to 2 minutes, we can take the cups off, and then we're just going to do a little bit of K-tape. So this is something we provide the patient to take home with them, and again, just to provide a little bit of support when they go home, and it also just helps with pain. So K-tape is an elastic tape that lifts up on the skin. So we'll go ahead and have the patient sit up. We're going to come this way. And then we want to make sure, again, that we get the gel off so that the K-tape sticks. So let's make sure that we wipe the gel. And then from there, here in the office, we use rock tape, and again, we have a nice thicker brand so we can cover more surface area here. We're just gonna tear it in half. And then, again, we're gonna place the middle down with about 50% tension. Good. And then just lay the ends down with no tension so that it sticks. Rub it on and make sure that it sticks. And again, this rock tape is something that stays on usually for about 2 or 3 days. It's something that you can shower with, and when it's ready to come off, you'll just notice that, again, the edges start to peel off and you can just rip it off. So there you have it. That's how we treat low back pain following a car accident. Thanks for watching.